Welcome to another episode of the Smiles Ahead podcast. Today, we're going to talk about Botox in dentistry and a little bit of specifics of Botox in orthodontics and how they're used. I know they're talked about a lot. It's been a topic that gets more popular. So as always in these podcasts, we'll talk about a little of it, what's going to be in the first 30 seconds. And then if you want to join us, they're only about 8 to 10 minutes long. So as we all know, Botox is a neurotoxin protein that can temporarily paralyze muscles. Everyone knows it as Botox, and there's some other alternatives out there, but that's going to be the main one that's going to be used. These are used for, obviously, the main things that we've heard them are the non-surgical type facelifts, where you put them in your forehead, for your brows, for your crow's feet, and different cosmetic things that can be done. And it's been a great industry for that and helped out a lot of people. But what some people don't know is it's used for therapeutic things as well. We'll dive into the TMJ joint, the TMD. A lot of people have a disorder in that. It's very minimally invasive. It can have long-lasting results. It can help with bruxism. That just means clenching your teeth, which can help with headaches and some other things that have been just nagging people for a long time, and they haven't had any relief from it. So the first thing I'd like to get into, because it is dentistry, and most people have heard of what a lot of people come in and say, I have TMJ. Well, that just means your temporomandibular joint. What people are saying is when that hurts, it's actually a disorder. So we call that TMD. And that can be caused by a lot of different things and can be sometimes really hard to treat because you don't quite know what is causing it. So you have to go down the list of almost eliminating things to find out what's going to be best for that patient. And in the last couple of years, Botox has been something that's been used. Essentially what TMD is where that joint up there is attached to tons of muscles, and they have palpation areas. So when those get triggered, it goes through a neuromuscular transmitter, which causes the pain. This is where Botox can come into place. If we can find these trigger points, if we can find these palpation points, then we can put a little Botox in those areas, a lot of times in the masseter muscles or the muscles around it, that can cause that joint to relax, essentially. It sends that neurotoxin in there and says, hey, stop firing. This is not how we want to do things. And a lot of times that can get the muscles around it relaxing and get that joint feeling a lot better. They've also done things like injecting saline and injecting, they're like, oh, well, why don't they just put some numbing stuff in there like they do with the tooth? Well, that'd be a good idea. But the problem is when you're getting your tooth fixed, you only need it numb for, at most an hour, a couple hours to let the dentist do his work. And then once it's completed, it wears off and it's good. Well, with TMD, this is something that lasts longer. So once the local anesthetic wore off, you're still going to have that TMJ, TMD pain, and it's just not long lasting. So those can last even if it was a couple of days. You don't want to be taking injections, every couple of days to help with your TMJ. So what they found is Botox actually lasted up to 3 months in some of these cases and really gave people relief on this TMD and this TMJ pain. So it's been a great thing. Another thing with that is some facial pain. So as we talked about, a lot of the muscles in there, and this can be sometimes hard to differentiate between, is it joint pain or is it muscle pain? Is it facial pain? Where is this coming from? But if the doctor can get enough questions answered and figure out enough about the patient, we can find where they are, use even up the temporalis muscles, the masseter muscles, all these muscles that can really cause a lot of facial tension, which can in turn cause facial pain, can be relaxed with this neurotoxin of Botox. So that's another big one, is facial pain. Again, using all those to go, even the medial and lateral pterygoid. So you have all these muscles. There's a number of muscles that are all in the mouth. Some that are attaching to bones near the back, some that are making facial expressions. They're just essentially everywhere. So there's a lot of room for some discomfort and some pain in those, and Botox can be a really good option if it's in the right place. With that too, with TMD, a lot of people have migraine pain. So they get constant migraines and they can't figure out why. Botox has been related to that as well. So, you get in specific areas in the head and neck, and I'm not as familiar with that just because it's not as much a dental thing as it is a neurological thing, but they have had some success. So even with migraines, it might be something you want to ask your physician or, somebody that might know a little bit more about migraines than I would. We're TMD specialists, but not migraine specialists. So that's just something I wanted to add in there. I know a lot of people have issues with migraines, so it's something to be aware of. The next thing with dental that we see all the time is what's called bruxism. Bruxism is a fancy word for clenching your teeth. And we know a lot of people out there are doing that. And you're either doing it at night and you don't even know it. You're doing it during the day. You can do it when you're stressed out. Some people are just more programmed to do it no matter what. So we always say, well, is something stressing you? And they're like, not really. So it doesn't have to be that, but a lot of times it's somewhere where at nighttime you're doing it unconsciously, and then during the day, usually during stressful times, maybe when you're sitting at your desk firing off emails, everybody's a little bit different, but the point is it can cause a lot of issues. One, those teeth are hitting together really hard and squeezing each other, so they can actually wear down the physical teeth and cause harm to the periodontium. So you can eventually get bone loss down there. You can eventually need gum grafts and that type of thing. So just the teeth and the gums and the bone alone, it can cause some issues. So then you have the issue of the muscles around it. Once you're clenching really hard, it's like, I always tell people it's like holding a dumbbell with your bicep curled for hours at a time and then relaxing it and wondering why your biceps hurts. Well, it's been sore because it's been working for hours and hours. And that's the same with that big masseter muscle, that one that comes right down the side of your cheek there. If you're just squeezing that, there's some others too. Again, the temporalis muscle can do a lot with that, the lateral and medial pterygoid. So there's some major muscles in there that that really cause that clenching down, and what we call muscles of mastication. So if you have that issue, some people use night guards, which we recommend. That's usually the first thing we recommend. Hey, let's see if we can get a night guard in there. It lets you hit all the teeth at one place, so that allows your muscles to relax more naturally. And if that helps, great. Some people can get away with just wearing retainers. So just a simple plastic on plastic retainer wearing at nighttime just eases up that clenching, protects the teeth, relaxes the muscles, and you're good to go. If it goes another step further and we need something else, so say these are not working, mouth guard's not working, retainers are not working, we're still clenching down, we're busting through retainer, whatever the case may be, then Botox can be another option on that. And again, what that can do is simply be injected in some of these muscles of mastication, the ones that we talked about before, the masseter muscle, the temporalis muscle, that can cause these muscles to relax. So it sends a signal to the nerve to basically, freeze them essentially. And that can cause them to stop firing, stop causing that clenching as much. It can protect the teeth. It can give headache relief. It can give TMD relief. It can give anything that the bruxism is causing. And that's another thing. So bruxism can cause temporomandibular joint pain, that TMD we talked about. It can cause headaches. It can cause, just damage to the teeth. So if we can get those muscles stopping to fire, we can kind of see, okay, maybe if the muscles are not firing and it's still hurting on one side, okay, now maybe it is actually in the joint, but we know it's not a muscular thing. So sometimes Botox can be the answer. Sometimes Botox can show you, okay, we removed one thing. We know it's not that. Now it's this. So that's also can be helpful as well. And a few other things that people might not think about that Botox can help with dentistry, with orthodontics. So in orthodontics, we're trying to get that nice smile line. So you want your teeth nice and straight, but you also want a specific gum line that's going to go specific with the smile line. And sometimes people just have a little bit too much gum showing, and it can be from a number of different things. This can be because the actual maxilla skeletal bone is too far down. It can be from the gums are too long. so it has to be diagnosed right. But sometimes it's because the soft tissue of the lip is just up a little bit. So what they have found is a little triangle between these small facial muscles that really lift up the lip, help support the lip and this type of thing. So if they can get the Botox there, it will relax those muscles and let that lip come down a little bit further and, release the lip so it's not as a gummy of a smile. A lot of times this is used with other procedures. You might get, the gums cut down a little bit. You might get a maxillary surgery to lift that up a little bit. But this is another thing that can either enhance that, or if it's very, very slight and you just want a small amount, it can do that as well. So that's something that can help, especially at the end of orthodontics when you really have that straight smile, that good bite, but you just want a little bit different with that smile line. That can be a great thing. It can also be great with veneers as well. So when you get veneers, your smile line is going to change a little bit, and you want that to be real nice and pretty. So sometimes that can enhance some cosmetic dentistry as well. And then we get to complications. You want to talk about some of that stuff too. Obviously with therapeutic, there's going to be higher doses of Botox given. So if you have any side effects like, the nausea, whatever comes along with your side effects of Botox, this could be enhanced if you're using it for TMD or anything of that nature. So just be thoughtful of that. Your provider should, make sure that you talk about that prior to it. There is about 7% of people that become basically accustomed to it, immune to it, that just aren't getting any reaction out of it. So they are working on some other things that can help that small percentage of people. And then you want to watch out for changes in facial structure. So if you're affecting the muscles, we talked about, if that muscle on the side's really hyper and really going, and then you essentially paralyze it, you're not going to be using that muscle as much, and you can get some atrophy as well. So some people have noticed that their face caves in a little bit, or that muscular isn't as defined, and it maybe changes their face some. So if you're using it over a long period of time, this could be something that you want to watch or talk to your provider about. But overall, Botox has been great for dentistry. It continues to go state by state, and dentists are getting better trained in it. We're figuring out better methods to help our patients. It's used all along, a lot in cosmetic dentistry, again, in orthodontics to help those smile lines, periodontal work to help not cause damage to those teeth. So it's really done great things. So if you have any questions about it, most dentists will know a lot about it, and a lot of them even provide it. So some people don't even know that their dentists have these things because they don't really talk about them too much, and the patient hasn't said that they have these type of symptoms. So make sure you're talking about it, ask about it. There's plenty on the web too, but we can answer as many questions as we can below. And I just thought that was a fun topic because a lot of people have been asking me about it. A lot of people have been saying, hey, do you do Botox here and there? I'm like, well, it depends. So just ask us, and we will see you next week for another episode of the Smiles Ahead podcast. Thanks for listening to the Smiles Ahead podcast, powered by Burrow Welchel Culp Orthodontics. Be sure to leave a rating, hit that subscribe button, and if you have more questions, you can reach out to me directly at sam@bwcortho.com. That's sam@bwcortho.com. You can also visit our website, bwcortho.com, and we will be happy to answer any questions you might have.